Hi there, I'm Christine Dunbar from speechmodification.com, and this is my Smart American Accent training. In this video, we're going to look at the words cartilage, bone, and joint and help you to pronounce them correctly and easily in your everyday speech. So first of all, in the word cartilage, we have 3 syllables. The first syllable, car, is stressed, and it has the clear R diphthong. If that diphthong gives you trouble, work on that separately in other words and then work to building it into cartilage. You just want to move into the from the more open ah position. So trying R, car, cartilage could be helpful. Then this letter T says more of a D sound. It's actually a flap because it's between two vowels and it's unstressed. It's followed by an unstressed syllable in this word. So think about it like a D, cartilage. This letter I has a schwa sound or maybe an I sound. It's a reduced vowel, so you want to be really short and lax on it, cartilage. And then again, we have another reduced vowel. This one is more like an I in the end of the word. The letters GE at the end say the J sound. That's something that we spell with letter J at the start of words, and we usually spell it with GE or DGE at the ends of words. We'll talk about that J sound a little bit more when we look at the word joint. So putting it all together, cartilage, cartilage, cartilage. Then in the word bone, the thing to watch out for is the O is a diphthong in American English. So just make sure you're holding it longer. You relax and close the jaws, you're saying the O. You might find it helpful to say the word bow first by itself because that's easier to have the length on the O and then add your N. Bow, bone. Then when we move to joint, we're back to our J sound at the beginning. So this sound, you can see the symbol for the sound. It looks like a D and a J sound together. So my tongue starts in the position for the D, but then it drops down and the air can push out. J. If I didn't have my voice on, it would sound like ch. So if you can say a word like cheese or choice, you can turn your voice on and say the J sound, joy, joice, joint. That might be helpful for you as well. The letters OI represent one sound, the gliding diphthong, oi, oi. We also sometimes spell that with OY. Again, this is a place where to get the oi sound, it might be helpful to just say the first part of the word without the final consonant. So if you can say the word joy, joy, holding that vowel long and reducing, closing the mouth as you say it, losing the roundedness. So I start with rounded and I end up with an unrounded sound. Oi, joy, joint, joint. Because the T falls at the end of the word, sometimes in a word like joint, we use a stopped T there where I don't release it. It's okay to release it, joint, but in natural speech I might say the joint is having problems. We have a knee joint and an elbow joint. So you may not hear that T. Don't leave it off. Don't say join with a long N because that would sound like the word join. So you have to make a short N, move your tongue up to mark the T, joint, and just don't let the air out. But it is okay to let the air out. I can say joint with a little bit of a T sound. Okay, so once you can say cartilage, bone, and joint by themselves, do try practicing them in some short phrases so you make sure that you get all these sounds correct and you can say it naturally with the new pronunciation easily in your everyday speech. Thank you for the request. If you have a request you'd like to see me cover in this series, feel free to leave that in the comments for this video or any of my videos. You may enjoy our medical words playlist if you have to talk about body parts or other medical words a bit in your work, or if it's just an area that you feel you need a little brushing up on, you can check that out. We will be back again tomorrow with another Word of the Day class, as well as on Friday, I'll have my live question and answer class. You can attend, type your questions in the chat, and I'll answer them for you live. Thank you to my channel members and subscribers. I really appreciate your support. Hope to see you here again soon. I'm Christine Dunbar from speechmodification.com. Remember, if you want to sound like a native speaker, you can do it. speechmodification.com. Bye, everybody. See you soon.